What are the biggest mistakes professionals make when working with medically fragile autistic children or medically complex individuals? Let's keep it in the realm of ABA
Yeah.
because we have seen some mistakes. I mean,
Yeah.
first and foremost, arrogance. You
Yes.
think you know,
Yeah.
but you don't know. Back
You
off and ask the nurse
exactly.
immediately. Yeah.
Exactly. And read the room in terms of stress levels. How are
Yeah.
we doing today? Is this really a day for a lot of parent education? I think other mistakes that ABA professionals can make are subtle, making a comment, making a face. I think parents are very um, sensitive to how their child is perceived. Um, and a lot of the things that these children have to go through can be um, unpleasant.
Yeah.
Not everybody, certainly in ABA, are trained in how to handle a lot of the bodily situations that these kids experience. And so if you make a face or maybe make a comment about something looking different or um, that can come across as judgmental or
Oh,
can
so
come
does.
across, yeah, it's really um, unacceptable. And I know we're working really hard to make sure that our staff are aware before they go into homes of their nonverbal communication and also bringing any concerns that they have to their behavior analyst, not directly to the parent,
Or the nurse.
or the nurse.
Yeah.
Yeah, because that's part of working as a team. And it's part of, maybe there are variables with this child that the therapist might not understand. And so having that discussion internally first before we do it collaborating as a big team, I think does help with some of those miscommunications.
Yeah. I think a lot of times well-meaning behavior therapists are like, my cousin has epilepsy. Well,
Hmm.
you need to back off because there's a big difference between knowing about and knowing of or living experience of something.
Absolutely.
And then stay within your scope. Just
Yeah.
let the nurses lead the team.
Hmm.
Don't make comments about medical procedures. Don't
Hmm.
give your opinions. Just let the nurse do her job and
Hmm.
she will let you know.
Hmm.
Okay, he's ready to go. Like
Yeah.
they'll let you know when to restart or to
Yeah.
begin this session.
Yeah, and I think it's also good to get into a rhythm in terms of, okay, the nurse is coming in to do some toileting or a diaper change or whatever procedure. That's a great time for the therapist to step out and give privacy. Um, I think sometimes professionals can feel like, well, this is my domain and I'm doing this work, and so I'm going to stay right here until they're ready to continue. Well, sometimes that's not as respectful as you should be in that kind of situation.
Yeah. Giving privacy, unless there is a plan for you to support that nurse.
Through behavioral issues.
Yeah, through
Mhm,
behavioral issues. Like we had a little one who had a trach
mhm.
and he kept poking the trach and he was causing harm.
Yeah,
And so we did have to assist the nurse in some behavioral strategies while she did other things, but
yeah,
that was talked about and agreed upon beforehand.
absolutely.
So I think that is really essential. I think the biggest, most arrogant thing that you can do is saying, "Well, I know because my cousin's friend has autism
Yeah.
epilepsy," or "I know because," you don't know.
Yep.
And you need to check your experience at the door and kind of sit back, listen, and watch these routines and learn the flow of the house and
Mhm,
learn, okay, when is good time to run session and run programs and when is not. And
mhm.
the people in the house will kind of let you know of the routine and say, okay, he's all set to go. And they'll
Bring him back to
yeah, they'll bring
session,
him
yep.
back in session. And so
Yeah.
um, and then not to ask overtly amounts of questions. You don't need to
Yeah,
know everything about their job because you don't need to do a nurse's job.
and
You know,
yeah,
like what's that? What are you giving him? Like those types
yeah,
of questions can also come off as extraordinarily arrogant from a clinician.
yeah, it can be really distracting as well if you're trying to do your work and if that work requires some sensitivity, which I think most nursing work does, to be answering questions about, well, what's that and what's this for? And, is not necessarily helpful. I also think that in communication with parents, um, a mistake that I witnessed once was someone asking, "Well, did they ever walk? Could they ever do these things?"
Yeah.
And asking questions about ability from the past can be so traumatizing, whether or not the answer is yes or no. It doesn't matter. And it certainly doesn't matter for our behavioral intervention in that time. So I think a lot of those mistakes are made when therapists are uncomfortable and they feel like they need to say something, when sometimes the best thing you can do is just be quiet, be present, and be supportive.